September is Prostate Awareness Month, and the Minister of Health and Wellness, Dr. Christopher Tufton, has now turned to women to encourage men to get screened for prostate cancer.
Interesting.
In his message to mark Prostate Cancer Awareness Month, which is being observed during September, Dr. Tufton highlighted the fear and apprehension that most men have about prostate cancer screening and pointed out that women have the ability to positively influence their men in this regard. He said, and I quote, "I therefore call upon our women to encourage us and to hold our hand even as we contemplate the screening and regular checkups that are essential." He indicated that prostate cancer is the most commonly diagnosed cancer in Jamaican men and the leading cause of cancer-related deaths among the male population. With us this morning is Dr. Alfred Dawes, and he'll be sharing some facts about prostate cancer and why it is important for men to get screened early. Good morning, Dr. Dawes. Welcome. How are you doing today?
Morning.
Hi, good morning. Thanks for having me.
All right. What can you tell us about what it's like out there as you did your daddy duties earlier? Is it hectic?
Oh, no. I was out riding. My son is overseas.
Oh, I see. All right. I thought you were doing daddy duties. No worries. Always good to have you on the program, Dr. Alfred Dawes. And this morning we're looking at prostate cancer in Prostate Cancer Awareness Month. First of all, Doc, what is prostate cancer?
The prostate is a gland that is right at the base of the penis, and it sits between the bladder and the roots of the penis, you could say, and it produces the fluid that comes out in the ejaculate. It's about the size of a guinea, and it can get bigger with age. But the problem is that some of these cells in the prostate can turn into cancer cells when they stop listening to the commands of the body to stop growing after a while, and that is essentially prostate cancer. Starts by invading the surrounding tissues, may have difficulty urinating, may invade the nerves, you may have impotence, pain, and then it spreads commonly to the spine, and unfortunately, many men are presenting when it is already spread to the spine, and they're coming in with weakness, paralysis, and back pain.
So you've also answered my next question, which is pretty much how it affects men. But let's go back to what causes it, Doc.
Well, we still don't know what are the main causes for cancer. As a matter of fact, you can just attribute cancer number one causes to bad luck, because many persons don't have a risk factor. But what we do know is that as a black man, you do have an increased risk of getting prostate cancer. Not only that, you have the risk of getting it at a younger age and a more aggressive form of prostate cancer.
And greetings, Dr. Dawes. Shells here. What are some of the symptoms or signs of prostate cancer?
Well, the early ones that you may see are trouble urinating. You may have difficulty starting or stopping the urine. We said that you start to hit your shoes instead of hitting the wall. You may see blood in the urine, blood in the ejaculate of the semen, and you may find out that you have erectile dysfunction. And when it has already spread, you may have weight loss, bone pain, pain in the pelvis, and pain in the back. So if you're having any of these symptoms, one of the things is that the urinary symptoms can be caused by another condition we call benign prostatic hypertrophy, and that is when the prostate itself just gets enlarged. In a case like that, there's a lot of overlap with the symptoms with prostate cancer. And it's best to, if you're having any urinary symptoms, go and check it out, because BPH is very common in the population. So,
and you say go and check it out. Yes, Doc. So I was about to ask, when then should men start testing for prostate cancer? And please also go on to tell us why there is this fear, it seems, among the male population to test.
Well, people are hung up on this whole digital rectal examination where you insert your finger into the rectum to feel the prostate, because it is sitting right in front of the rectum. So it's because a lot of the times prostate cancer starts on the outside of this organ, you can feel it from the outside on the surface, rather than BPH that usually starts on the inside. So feeling that prostate, the size of it, and if there's any irregularities or nodules, is an important part of screening. And unfortunately, that is what most men are hung up on, and they don't want to undergo that part of it. They think it's invasive. But it really and truly, it's one component. The other component is the blood test or the PSA. This is a protein that is produced by the prostate. Not at certain sizes, the PSA is going to be less than 4. Right? But if it gets enlarged, or if you have prostate cancer cells making more PSA than usual, it's going to go up. So I would recommend all Jamaican men to start screening at the age of 40. In some countries, they would tell you at the age of 50, but because, we are seeing more aggressive variants and earlier variants because of our race, obesity is another risk factor that is becoming more prevalent, and men who have on a little weight, they ought to be looking carefully at this disease as well. But rule of thumb, once you get to 40, get your annual PSA and DRE, or digital rectal examination. And it's best for you to just find it early, where the treatment is easier, cheaper, and more effective. It's not something to be afraid of.
So let's be absolutely clear, Doc. There's no way to circumvent that particular initial test.
Well, yeah, that is actually controversial, because we have to look at it now from practical versus ideal. We know that Jamaican men are getting advanced cancer. At one point, there was a study that said that we had the highest rate in the world, but that has been questioned. What we do know is that we have one of the highest death rates from prostate cancer in the world. It's the number one killer of all cancers, male and female in Jamaica. About 850 men die every year from prostate cancer. And the reason is that we are diagnosing prostate cancer when it is late. Now, the ideal situation is to get the DRE and the PSA. And at some point, we have to examine our local situation and say, boy, the men are not coming in. So should we be just offering them the PSA if they want to, rather than holding out and saying, no, you have to do it the right and proper way? Maybe if we just say, get the PSA done, more men will feel comfortable coming in, and an abnormal PSA will direct us as to who needs further screening, and then we can capture more persons with prostate cancer at an earlier stage. That's controversial, and it's a part of the reason why we don't have a national screening program for prostate cancer. But I think at some point we have to look at it and say what we are doing, looking for the ideal situation, is simply not working. So we have to try something different.
All right. It's the first time I'm hearing that coming from a doctor, actually. Yeah. So you did say it's quite controversial.
Doc, is prostate cancer acquired or inherited? Or neither?
Well, you do. If you have a family history, a blood relative, parent or a brother who has been diagnosed with prostate cancer, you are going to have increased risk. Breast cancer as well, especially if it is linked to genetics, then you will have an increased risk of prostate cancer. Okay. But the biggest risk factors really are your age over 40, and once you're a black man.
How prevalent then is it amongst the male population?
Well, when you look at prostate cancer, I think it's about 23 per 100,000 men who are getting this. It is by far the most common cancer in Jamaica. It's more common than breast cancer. It's more common than cervical cancer, colon cancer. So when you're talking about one single cancer that is responsible for most of the cancer cases in Jamaica, that is prostate cancer, right across the board.
The view has been put forward that by Minister of Health that he's encouraging the women to encourage the men to go to get this screening done. But what do you believe, personally, Doc, that can be done to encourage more Jamaican men to get screened early?
It's unfortunate that a lot of times when men come in my office, it is a girlfriend or a wife who has dragged them there. Because men don't want to come in for anything, whether it's blood pressure, sugar tests, prostate cancer screening, until something has gone wrong. And at that point, it's not really screening anymore. It is a diagnostic evaluation because you started to have symptoms because of disease progression. Education is a big part of it, and as I was saying before, it's controversial, but we ought to be looking at maybe offering men the PSA test by itself if they feel like that is what they want. Offer both options and explain that it is the PSA alone does not replace it. But if that is what you feel comfortable doing, then come in and get your blood test.
I suspect that throughout the month there'll be many avenues that persons can learn more about this disease, and we'd love to hear more about that. So if you have any information to share as we go along, Doc, you can always pass on to us, all right?
All right.
Thank you so much for your time today, and have a great day.
You too. Take care.
All right, Dr. Alfred Dawes, our very special guest, looking at prostate cancer during Prostate Cancer Awareness Month. He's the founder and CEO of Windsor Wellness Center.